Gold Coast Health has one of the busiest emergency departments in the country. A dedicated trauma unit operates at the Gold Coast University Hospital and now sees more than 2,000 trauma patients every year, from as far south as northern New South Wales and right up to Logan City in the north. Managing complex patient load requires an efficient patient handover and follow-up. Welcome to Tele-Recover. Tele-Recover is designed to improve patient flow, access to specialist services, and the patient experience in trauma recovery. It started in 2015 and is now part of the trauma service model of care at Gold Coast University Hospital, as well as being an exemplar model for other hospitals.
To design the Tele-Recover pathway, we looked at the trauma patient journey and where telehealth could be used to improve patient flow, communication, and the patient experience. Tele-Recover uses telehealth for handover, access to specialist services, and follow-up in the community. The unique part of Tele-Recover is using telehealth for clinical handover. This involves the multidisciplinary team, including medical, nursing, and allied health staff, coming together at both sending and receiving facilities to discuss the patient.
The project came along from the Healthcare Improvement Unit and the Statewide Trauma Clinical Network, which I'm a member of, and then in my role here as the Director of Trauma, I'm heavily involved in the trauma patient. The driver of the Tele-Recover project was basically when we looked more into details about the transition of our trauma patients, how they got home. And looking into that, it was really about the process to getting them earlier and closer home. And we came up with the idea to use telehealth to facilitate that process.
I'm a farmer in northern New South Wales, and I was cutting trees down and one landed on me and smashed my pelvis and bladder. And I was airlifted to the Gold Coast University Hospital.
The first tele-link-up was the handover to the Lismore Hospital, and the trauma team went through everything that happened to David. Using this system, I was able to get to see Dr. Reedy without going through the trauma of the transfer, which was an hour-and-a-half drive both ways. Took a whole lot of worry out of getting David up to the Gold Coast for the ongoing care that he needed and the continuity of care that he needed. We were able to just stay in our local area, and we received help there with the tele-link-up. It was a huge improvement on what it would have been otherwise.
So as the clinician transferring the complex major trauma patient up to the receiving hospital, we can be assured that a quality handover has taken place. Everyone is informed of where the patient has come from and where they need to go, which means ease of transfer for the patient and better patient outcomes.
The benefits of this model are clearly that we improve communication between teams. Then we also do our patients telehealth back in the Gold Coast University Hospital to the specialists once the patient is discharged to another facility, perhaps in New South Wales or also locally. And the other benefit is really for the health professionals and the costs as well, that the health professionals, they get in a better communication style, a handover, like a more holistic approach. It's not a one-to-one handover as we used to do, so it's team-to-team handover, so everybody hears the others talking as well, and you can bump off questions and really finalize a handover or a reception of a patient much better.
We have the opportunity to have face-to-face handover with the clinicians that are receiving care of the patient. So everyone is sitting down in the room, the whole multidisciplinary team is able to be there and hand over the patient to the receiving team. We even have the ability to include the patient in the Tele-Recover handover, so the team at the receiving hospital are able to ask questions of the patient, and the patient is able to ask questions of the receiving hospital as well.
Tele-Recover makes things easier for clinicians and better for patients. We'd love to share this model so others can experience the same benefits we have on the Gold Coast.